I wonder whether you could tell me really about your journey of introducing digital consulting in Bristol and at your practice in particular.
Yeah, sure. Well, it's probably about 2.5 years ago as a CCG, we decided to start the process of implementing online consultations for our practices. And so as part of that, we initially engaged with the main suppliers on the market at that time to understand the functionality which was available.
Yeah.
And then following that, we then sought out 5 practices who were quite keen to pilot this type of approach. So of which my practice was one. So and we then, using those practices, we then ran a procurement process really with the main suppliers to then identify 2 products of which the practice could choose which one they wanted to go down. So we divided the products up really into 2 sort of main categories. One was more a sort of a questionnaire-based approach where you get a document coming back to the practice with the patient's feedback on. Another was more integrated with the clinical system, which the idea behind that was it took the patients through an algorithm and then pushed them into, gave them the options of an appointment slot. But after looking at the alternatives, even though the second option sounded more interesting, actually, we felt in some ways it was more inflexible for our practice, and we opted to go for the questionnaire-based route, as we felt that would fit our practice better. So so actually the process of implementing it was actually quite a journey, I think, really. So these products do produce quite a fundamental change to the way that you engage with your patients. And for us, it threw up a lot of issues that we hadn't fully appreciated before we started, I think. So we somewhat courageously opted to move to almost like a total triage option to begin with, where for patients who wanted to be seen, urgently, we try to push as many through the e-consult process as possible. And for those who, weren't digitally enabled, we had a separate sort of questionnaire-based approach our receptionist ran. So, but I think at the time, it was probably too much change all at once. I think you have to change both clinician and patient behavior for this to work. And though we had targeted the patient behavior quite well, we hadn't fully appreciated the changes needed in our clinical workforce to make this work well. So we found initially it actually created work rather than saved work. And we, after a few months, we downgraded the process to more of the patient choosing whether they wanted to use it or not. And that, at that time, worked much better for us. I think if we were to do it now, I think COVID has changed everything completely. And I think both clinicians and patients are much more used to this sort of more remote form of working. But maybe a slight digression. But I think from our point of view, it really opened up a new channel once we understood the issues around it. And we managed to build a new workflow into our practice. Actually, I think it's produced quite a few significant benefits for us. I think from our patients, now that they have a choice whether or not they use it or not, actually those who do like it, choose to use it, seem to really like it. Our satisfaction results from the questionnaires that the system produce have actually been quite been very good, with 85-90% of people who use it now saying that they find it very helpful and they would recommend it to their friends. So
that's a really high level of satisfaction, isn't it?
It's a high level. So and from the clinician point of view, because the e-consult system actually has about 100 bespoke questionnaires that are targeted for the particular condition, it means it goes through a whole series of questions that actually take a pretty good history, identify the red flags, particularly for those conditions. If the system determines that from the answers this patient actually shouldn't be waiting a day or two for a result, it will actually push them out and suggest they go down a different route. So those if you like, someone with back pain who has a possible cauda equina, they will be pushed out and told to go elsewhere. So you don't have serious things hopefully sitting in your list waiting to be seen. So but actually, as a clinician, if you disciplined and you read that e-consult, it makes your then history taking later with your patient much quicker, because a lot of the information has been already presented to you. So
what about elements, I think you mentioned before when we were speaking just before this event, about patient empowerment? What sort of that was one of the principles of sustainable healthcare, and you thought that that you can increase that as well through this change?
yeah, so I think in several ways. One, I think I think the questionnaires are quite well worded in that they actually try and encourage the patient to think about actually what were they hoping from this consultation. Do they have any particular concerns or worries? So, you know, it helps them to, if you like, express their concerns and think about actually what they hope to achieve from the consultation before they, you know, before they actually engage with us, which I think is very helpful. I think the fact it allows patients to seek advice at a time which is convenient for them, I think is very good. It's actually reduced our big surge of telephone demand on our telephone lines first thing in the morning. So
That's interesting.
So it, you know, it has reduced our telephone queues and helps us provide a better service for our patients. But you know, I think it. And the other thing I think around is actually we're starting to use it for chronic disease management now as well, in that there are a number of templates which have been produced specifically for chronic disease. And again, hopefully with, you know, going down that route, we can help people engage more with the management of their, you know, their long-term conditions as well as their acute illness.
Okay, that's been really helpful, thank you. And in terms of working at a systems level, I think you mentioned you've been working on a dermatology pathway. I'm just wondering how that's increased the sustainability of that pathway through introducing digital elements to that path.
I think that's a really interesting pathway, because that goes beyond just the online consultations we've talked about just now, and actually focuses on other elements of, if you like, remote consultations as well, in that I think for a year or two we've been using a tool which allows us to text patients. And actually, as when COVID hit, the company who we were using for that, a company called AccuRx, actually developed quite a lot of additional functionality within that, which allowed patients to send documents or images to us, and us to send links to documents back to them. So, and this actually opened up some doors in the dermatology pathway, in that as a practice, I have a keen interest in dermatology myself, and I do dermoscopy, so that it allows, if someone phones the practice with a skin lesion, we actually get our receptionist to send them a text straight out to say, please send us a photo of the lesion. And the idea then is that we can look at that, we can then either say we can treat that, we need to see the patient, or this patient needs referral on, and then we can, we currently use ERS as the electronic referral system, the national system, then to send a request off to the dermatologist with the photos attached. And if I've seen and done dermoscopy, I can send that dermoscopic image as well. And that then allows the dermatologist then to look at that and then say, like we've just done with the patient, they can say back to us, here's the treatment that you should be doing, you can go ahead and manage it yourself, or I'd like to see that patient, and they may then choose a video consultation or a face-to-face, or they may even get some dermoscopic images done by medical photography and prior to a remote consultation for that patient. So it's opened quite a lot of doors up in that pathway to manage people in a slightly different way to the way we were doing before.
Yeah, it sounds very lean, and also saving a lot of patient travel, and I imagine a lot of time having to go up to the hospital for all those appointments. Yeah, wonderful. Thank you, Andrew.